Have you ever cared for someone who has difficulty communicating? Communication challenges may be the result of motor speech disorders, mild cognitive impairment, language barriers, or, if they are a stroke survivor, 1 in 3 will have aphasia. Aphasia is a communication impairment that is the result of an injury to the brain. It can make speaking, understanding, and communicating difficult and have a huge impact on the stroke survivor and their quality of life, as well as their family, friends, and caregivers. As someone who supports individuals with aphasia, you will encounter a variety of unique communication challenges, including a person's ability to speak, express ideas, converse socially, understand language, read, and write. Aphasia impacts a person's ability to use language. It does not impact their intelligence, personhood, or competence. Ultimately, individuals may be left out of their own healthcare conversations and struggle to provide consent or follow directions, thus requiring assistance from a support person to advocate on their behalf. The individual experiencing aphasia can feel isolated, become reluctant to communicate, and even begin to question their own competence. As a healthcare provider, it is important to include them in conversations and encourage others to do so as well. So how can you successfully communicate with an individual who has difficulty expressing thoughts, understanding verbal messages, or reading and writing? To ensure both you and the person with aphasia can be understood, there are a number of techniques you can use that have been designed to help overcome communication barriers. These techniques can be categorized using the acronym Aphasia. Ask simple and direct questions. Focus on one idea at a time and eliminate unnecessary parts of the conversation. You may find it helpful to phrase questions so people can respond using yes or no, or give a thumbs up or thumbs down. Provide a variety of communication options, including gestures and facial expressions, writing, pointing to key words, or using specially designed communication tools such as a pictograph. It is also helpful to move from general to more specific topics during the conversation. Help communicate when asked, but always make sure you are speaking with and not for the individual. Resist the urge to assume what a person is trying to say or to finish sentences for them. Acknowledge the individual's frustration while making sure you validate their attempts to speak. Avoid dwelling on communication errors. Speak slowly, clearly, and at a normal volume. Also, consider finding a quiet location with minimal background noise to avoid distractions. If you don't understand, say so, and confirm what you think the individual has said by repeating their message back to them. Allow extra time and don't rush. Not only can it take additional time for the individual to respond, but also people with aphasia may tire more easily due to the additional effort required to communicate. Provide time to rest and, if possible, choose to revisit complicated conversations at a later time. Aphasia can negatively impact relationships and identity, which can lead to isolation and depression. Improving communication can lead to increased satisfaction not just for the person with aphasia, but for you, the healthcare provider. When working with a person who has aphasia, applying the communication strategies most appropriate to them will help to ensure more successful and meaningful interactions. If you have any questions, are interested in accessing additional resources or training opportunities, please visit our website.